Heart disease is the #1 killer of women, but a new survey in the Journal of the American College of Cardiology found it is not a top priority for women or their doctors. Cardiovascular disease causes 400,000 deaths a year, and that is more than all cancers combined. Think about that for a second. 45% of women are unaware of the danger. Our Dr. Tara Narula is a cardiologist at the Northwell Health, and she joins us this morning at the table to discuss, because this, Tara, is important and it's big. A lot of women say that they want to lose weight before they go to the doctor. They say they'd much rather do their taxes than go to their doctor. How can this be when heart disease is so important and so prevalent for women?
It is killing one woman every 80 seconds, and yet women don't recognize that this is their biggest threat. So one of the barriers is that it's just not real for a lot of women. They say, I'm in shape, I'm too young, I don't have a lot of risk factors. In fact, in this survey, many said, I don't really know any woman who's had heart disease. So it needs to become more of a real threat to them. It needs to become personalized. That's one barrier. Another barrier is certainly the social stigma that you mentioned, which is a lot of women feel that if they talk about heart disease with their doctor, they might be looked down upon in the sense that, well, maybe
they'll be judged.
They'll be judged that they don't eat right, that they don't exercise. And so, in fact, 45% of women in this survey said they wanted to lose a few pounds before they went to the doctor so they could be their best self. I mean, that sounds crazy, but that's how these women are thinking about it. Other issues, women tend to downplay their symptoms. I can't tell you how many times women tell me, well, it's just stress, I'm sure. Or they don't recognize their risk factors or symptoms. You know, 40% of women who have a heart attack never had chest pain. They can present atypically with nausea, anxiety, jaw pain. So it's important that we make that awareness known.
So how often should we be screened for heart issues?
So this should be a conversation that happens at every visit. In fact, the American Heart Association recommends that women start having what they call a well woman visit annually, where you talk about risk factors, you get screened. One of the most interesting things about this survey is that doctors, primary care, and cardiologists felt unprepared to deal with women and cardiovascular health. And that's a problem. In fact, they weren't prioritizing it. They were prioritizing in this survey weight issues and breast health, not cardiovascular disease.
Tara, why is that a problem at this point? We've heard about this for years. The doctors tend to look at men for heart disease, but not women. Why haven't doctors gotten the message?
That's a great question. I mean, it has been under-researched, underfunded, understudied in general. And I think one of the big issues of this survey is to raise awareness in doctors that they need to be screening women every single visit. They need to be talking about this, not waiting for their patients to bring it up, because 71% of the women in the study waited for their doctor to bring it up. And if the doctor didn't bring it up, it didn't get discussed. So it needs to be a discussion happening at every visit. Women can have risk factors that are particular to them too that they don't often think about: depression, anxiety, autoimmune diseases like lupus, rheumatoid arthritis, pregnancy complications. So important to understand the whole picture.
And bottom line, an overwhelming majority of heart disease is preventable.
It is. That is the good news.
Yes. Thank you. Always good to have you here, Dr. Tara Narula. Thank you.